Hey, this is from my medical. The secret to buy clinical skill part 2. So this time is showing elbow dislocation simulator. Okay. So lately, jiu-jitsu is very popular. Schools, tournaments, it's a lot of event. So, and I noticed a lot of elbow dislocation. So that statistic wise, I think it's more than usual. Okay. So this one you can dislocate. Okay. Posterior dislocation. All right. And what do? Okay. So as I used to work for high school setting for 20 years as an athletic trainer in the state of Texas and San Antonio, and if you see it, I will try to reduce. Yeah. Do I recommend? No. Do I encourage you to do? I do not. Since I'm not a doctor, I just can't say it. But do I do it? Yes, I do. Okay. So before the reduction, what do I do? Okay. So I will ask, squeeze my finger if you can, palms up and down, right? And then of course, you have to palpate, right? And then if you feel mushy, soft, which means this part is cracked through it, then you can reduce it, right? So what you have to do, put it in a sling and then send it to the doctor. If you feel solid, okay, and you can ask the patient, it depends on the age, and they allow you to do, then you're gonna reduce. So I can show you like 3 techniques. One, okay, think about this is the exam table or some kind of table, patient's facing down, right? And then little extension, and then pull down. It's in, okay? Another one would be, think this is the ground, okay? Patient's on the ground, facing up. Put your arm straight, keep it, and then traction up. Okay? Or think about patient is sitting down already on the bench. Use the back side of the bench, okay? And then push, right? And then pull. So that's 3 ways. I always teach at the workshop, solo technique, something you need to learn, trying to learn, because there's no guarantee you're gonna help, right? The game day, you might have a doctor, which most likely you're not gonna do it, because the doctor will reduce it, so you can't reduce. But let's say just regular day, you don't have a doctor on site, they're not gonna come to school if you're working for high school setting. So if that's the case, then you have to reduce it, if the parents allow you to. So that's the case, and then or you can ask somebody to just hold it, right? If this is a big guy, 300-pound football player, and then you really need to reduce, you ask somebody to hold the arm, which attached to the body anyway, so you don't need to really hold it, okay? Then use your both hand and then pull down, So that's what I recommend. So I do workshop by using the shoulder model and the elbow and also finger, and the latest addition, Jenny hip. I don't have here to show you. I already shipped it to NATA convention. So I do workshop. So if you're interested in it, DM me, then we can talk about it. If you're interested in purchasing, let me know also. I can refer to my distributor. So thank you.